A holistic model of engaged scholarship. Faculty and administrators still struggle to practice and support a holistic approach to engaged scholarship. Many institutions have adopted the idea of engaged scholarship. However, faculty are looking for practical ways to complete engaged scholarship due to productivity expectations. New faculty are often drawn to the idea of engaged scholarship, but don't know where to start or how to frame their work. Universities struggle to plan, implement, and reflect on engaged scholarship. Institutions don't know how to reconcile the desire for engaged scholarship with the need for immediate signs of progress and productivity. New faculty who partake in engaged scholarship don't know how to describe their work in ways that make it appeal to the higher-ups. Problems like these led to the creation of the holistic model of engaged scholarship. Von de Ven's diamond model attempts to connect research and practice by suggesting 4 steps in a research process. Von de Ven believes involving scholars and practitioners in co-creating knowledge will strengthen the link between practice and theory. He focuses on the individual scholar, not the institution. Ernest Boyer, on the other hand, looked at engaged scholarship on an institutional level. Boyer redefined scholarship to move beyond the traditional definition of research and publication to 4 types. The first 3 reflect on traditional university missions of discovery, service, and teaching. However, the scholarship of integration focuses on the connections across disciplines and the functions of research, teaching, and outreach. Pennsylvania State University incorporated Boyer's 4 types of scholarship into the university scholarship and criteria for outreach and performance evaluation model. The goal of this work was to help academics and administrators better understand and reward wider types of scholarship, in particular, scholarship beyond research and teaching. The 3 types of scholarship in this model are teaching, research, and service, with discovery at the heart of all 3 and integration and application woven throughout. Engaged scholarship model builds on and adds to these models by more fully addressing the day-to-day context of faculty involved in engaged scholarship. The model has 6 entry points where faculty can practice engaged scholarship. The model places a simplified definition of engaged scholarship at the heart of the model, breaking the 3 university missions into 6 entry points, and adding internal factors, external factors, and assumptions as important aspects of successful engaged scholarship. This model is intended to help prepare faculty to think more fully about engaging in and sharing the outreach process. The definition in the center circle drives the 6 leverage points of engaged scholarship: discovery of new knowledge, development of new knowledge, dissemination of new knowledge, change in learning, change in behavior, and change in condition. The model points to the importance of having a clear definition of engaged scholarship at the core of this work for an in-depth understanding and application of the work across the faculty, institutional, and interinstitutional levels, along with suggesting the importance of having a variety of entry points to practice. Discovery of new knowledge, which involves scholars and communities working together in research to answer important questions of mutual interest. Methods for this work may include participatory action research, empowerment evaluation, or other joint inquiry processes. Development of new knowledge, or faculty and community members taking previously discovered knowledge and expanding on it or testing it in a new context. Dissemination of new knowledge. In this point of the engaged scholarship circle, faculty and community members share with others what they've discovered together. Change in learning, which focuses on determining to what degree people have actually learned something new from the information created throughout previous work in the engaged scholarship circle. Change in behavior, which focuses on change in human behavior using research-based information and practices. Change in conditions. The goal in this step is to effect deep and lasting change in economic, environmental, social, and/or civic conditions. Overall, each of the 6 points in the engaged scholarship circle encourages critical reflection, enhanced action, and production of scholarship between faculty and community members. A number of factors have been shown to slow or advance engaged scholarship. The outer circle in the model has 3 factors that impact the success of engaged scholarship. Internal factors. Institutions of higher education have multiple factors that affect this work. Lack of interest in collaboration, the history of organization, funding, organizational leadership, peer mentoring, and organizational infrastructure. External factors which include community commitment, communication, collaboration, trust, a mutually beneficial relationship, resources, the political environment, and the unique context of the community. Assumptions about engaged scholarship. Many assumptions guide individuals and institutions as they participate in engaged scholarship. They range from the value of this type of scholarship and best practices for conducting the work to how the work should be rewarded. Since this model is relatively new, it has not been fully tested. However, one current example of engaged scholarship at Virginia Polytechnic Institute and State University is grounded in this model. Two scholars from the Department of Agricultural and Extension Education and the Department of Human Development want to know to what degree the delivery of agricultural education met the learning preferences of farmers.
The scholars had noticed that teachers often teach in ways they prefer to learn rather than ways that meet learners' needs. The scholars wanted to see if this was true in the agricultural education community as well. The scholars tried to focus on the relationship between agricultural education community of practitioners and farmers. They created steering committees for the project. The steering committees were interested in helping farmers be more successful by improving educational offerings as well as improving educational infrastructure. Following the discipline of new knowledge, 5 focus groups and 2 surveys were conducted with Virginia farmers, extension agents, and specialists to determine how farmers prefer to learn and what that means for agricultural education. The steering committee produced products on this new knowledge that included a poster, research brief, research report, PowerPoint presentation, and a lessons learned report to inform the second year of the project. Also developing new knowledge, where in the second year of the project, scholars, agricultural educators, and farmers from Louisiana and Tennessee joined the project to further develop the knowledge learned in its first year. Focus group and survey questions were updated based on what was learned the first year. 10 focus groups and 1 survey were conducted in the 2 states, with agricultural educators and farmers assisting with the process. Similar findings on farmer learning preferences were found across all 3 states. Unintended engaged scholarship. Even though the project was supposed to end with knowledge dissemination about how farmers learn, other unintended engaged scholarship occurred. The scholars and community members on the project have become focus group methodology specialists and have been sought out by others to share their expertise. This project has taken on a life of its own and will continue long past the end of the funding. In some regards, this may be due to the strong engagement between the scholars and the community in this project. Dissemination of knowledge. The entry point of dissemination of knowledge for engaged scholarship was popular with community members. They worked with scholars to take the products produced and share them with numerous audiences. One extension educator from the original steering committee presented a workshop and a poster at the Virginia Biological Farmers Conference and applied to share the same at his National Association meeting with one of the scholars. The model could be even more dynamic than originally conceived. With the Farmers Project, several entry points for engaged scholarship were active simultaneously rather than in sequence. In the second year, while new knowledge was being developed in Louisiana and Tennessee, dissemination of knowledge from year 1 was happening in Virginia. This can cause a disconnect in the groups. Also, community members tended to engage more fully in knowledge dissemination than in discovering or developing knowledge. Dissemination of research findings may also have been fully engaged in by community members in this project because many of them already had vast experience in and vast networks for sharing information. The model for engaged scholarship presented here expands on Boyer's 4 types of scholarship, Van de Ven's research model of engaged scholarship, and the Pennsylvania State University's Uniscope model by more specifically articulating a process of engaged scholarship with 6 entry points for conducting and telling stories about engaged scholarship within and across institutional missions. The model could be very useful in orienting and mentoring new faculty on opportunities to practice engaged scholarship. Finally, this model could be used as a framework for higher education public relations efforts by showing decision makers, peers, and the public a wide variety of engaged scholarship from the creation of new knowledge to changing human behavior. This model also has implications for theory building and future research. The model also suggests that policies related to faculty work and workload need to reflect a variety and a more holistic set of points for engaged scholarship. Practicing community-engaged research. In 2006, the National Institutes of Health instituted a new emphasis on translational research, which focuses on the translation of scientific discoveries into practical applications that improve human health. A community-engaged research approach can enable researchers to strengthen the links between research and practice and enhance translational results. Yet, in order to practice community-engaged research, one needs to rethink the relationship of research and researchers to communities. Community-engaged research is an approach for conducting research, not a methodology. A community-engaged research study may incorporate both qualitative and quantitative methods, which encourages recognition of the strengths of community, institutions, and individuals, and encourages people and groups to build on the strengths. What characterizes community-engaged research is not the methods used, but the principles that guide the research and the relationships between researchers and the community. Community-engaged research requires partnership development, cooperation, and negotiation, collaboration with community partners, and a commitment to addressing local health issues. A community can be defined as a group of people who either live in the same location or have similar aspects of life in common. In this module, community is used to mean groups outside of academics. Researchers conducting community-engaged research will work with community leaders, community organizations and agencies, and community members. These groups represent different aspects of a community and are likely to have different perspectives. This module has 4 sections, each with learner objectives. Section 1 gives background on NIH's increased emphasis on translational research and an introduction to community-engaged research. Section 2 describes differences between the different types of research, such as traditional research, a community-engaged approach, and community-based participatory research. Section 3 describes how the community-engaged approach to research differs from traditional research and how it can be incorporated into the traditional research process. Section 4 goes over some of the risks and rewards researchers can face when using a community-engaged approach. In 2000, the leadership of the NIH confronted some long-standing issues in the conduct and use of biomedical research. U.S. health outcomes were worse than those of other industrialized nations. Although the U.S. is a leader in biomedical research, the link between research and clinical practice was weak. The communication between the communities and researchers was poor, which left community concerns and interests out of the research agenda. In response to these issues and others, NIH developed a new long-term plan known as the Roadmap, part of which included a focus on translational research.
It is important for there to be a strong link between research and practice, and strong communication and cooperation between researchers and the subjects when conducting community-engaged research. Doing so results in more interest in community-engaged research. Community-engaged research is one of many methods when conducting research based on medicine and health. Since the 1980s, the different fields of public health have incorporated the community-engaged approach into their research programs. By 2000, the community-engaged approach to research was being successfully utilized by multiple disciplines. HIV prevention researchers spent time with South African sex workers in order to determine what intervention they could use to protect themselves from contracting HIV. The sex workers collaborated with researchers to develop a peer education program which provided information on protection methods they could use without losing customers and earnings. Psychologist Kurt Lewin used the term action research to describe the process of communities identifying their problems, creating a solution, and analyzing the results. In the 1970s, adult educators from Latin America and the United States developed empowerment research, which emphasizes both the equality of the teachers and learners and the co-learning process. Empowerment research also incorporates principles of social justice and empowerment for the marginalized community. Theories from philosophy, anthropology, community psychology, and sociology contributed to the concept that there are different ways to understand and portray what is being observed, depending on the role and experience of the observer. These philosophical developments inform the belief that researchers and communities may have different views of community health issues, and that the unscientific knowledge of communities is both valid and valuable. Since the 1980s, some practitioners and researchers have incorporated these theories into community-engaged research. There is a difference between a subject and being a participant in research. With a community-engaged approach, communities are seen as partners and collaborators, and community members are viewed as participants, not as research subjects. Community members have not worked on the planning of the research or been involved in any way, but who volunteer and enroll in that research are still called participants rather than subjects. In medical research, subject has been the term used for people enrolled in a study. However, with a community-engaged approach, the term participant is standard. A main reason why participant is used over subject in community-engaged research is because many find the word subject to be demeaning, and thus will not help form a strong communication connection with researchers and communities. This table illustrates the main difference between a traditional research approach and a community-engaged research approach, which includes the community-based participatory research approach, or CBPR. CBPR appears at the end of the spectrum since it embraces the greatest degree of relationship building, strong community partnership, and collaboration through the research process. The graduations within community-engaged research show that it exists on a continuum from low community engagement, left in dark blue, to high community engagement, right in light blue. Community engagement exists on a continuum, and there are many combinations. Health researchers used a common method that many different scientific fields used. Researchers develop research questions, write proposals, secure funds, conduct the research and analysis, and write papers. Community-engaged research builds upon traditional research. The main difference is that community-engaged research, there is a strong relationship between the researchers and the participants. In California, the Hotel Employees and Restaurant Employees Union, HERE, was concerned about high rates of injuries and musculoskeletal problems among hotel cleaners. The union suspected that these problems were job-related and contacted researchers at the University of California about doing a study. The union identified research priorities and some of the research methodology, and they wanted the hotel workers to be involved with data collection. They also wanted the study to be scientifically sound. Researchers collaborated with the union and its members to identify potential risks and contributing factors, design a survey for hotel workers, and recruit and train groups of workers to administer the survey. After analysis of the survey results, researchers held focus groups with hotel workers to examine the findings and solicit explanations, and interpretations from the workers. Researchers wrote a report, and the union was able to use it as a bargaining tool with management for improved work conditions. The term community-engaged research is broad, and the full spectrum of approaches that involve the community in the research process. It includes research that incorporates only a few elements of community engagement and minimal collaboration, to research in which community organizations and researchers are equal partners throughout the process. The extent of the collaboration, when it occurs in the research process, and the relationships among research and community organizations may be very different from project to project.